So the ACEs study, I think, gives us a helpful framework for
Mhm,
thinking about how our health is impacted as
mhm,
a result of experiencing toxic stress during childhood, especially. And that study came out of Kaiser in California, a study that was partnered with the Center for Disease Control in the 90s. That's
mhm,
taken us about 20 years to kind of get our general public aware of. But in that study, more than 17,000 individuals were assessed for their experience of 10 different types of adversity in childhood and how their state of health was in their adult life. The major chronic health concerns um, that were assessed in those individuals were found to be more prevalent if they'd experienced one of the 10 ACEs that were part of that study. They included physical and emotional or sexual abuse, physical or emotional neglect, include mental illness of a caregiver or someone in the household. If there's domestic violence in the household, especially that targeting mom, divorce or separation of those caregivers, those primary caregivers, substance abuse, and incarceration of a family member.
mhm.
I always like to give the caveat that when we look at the ACEs study, we should always remember that that work was not exhaustive. It is not intended to make a determination for our lives if we've experienced those kinds of things. But in that study of really privileged and resourced people, quite frankly, it was realized that the physical, mental health, um, and the way in which individuals live their lives in adulthood were greatly correlated with the experience of adversity in childhood. And so some of the health conditions that were more prevalent when there
Mhm,
was an experience of adversity in childhood were included lung disease and cardiovascular diseases like high blood pressure and heart disease, but also mental health conditions like depression,
mm,
risk for some challenges such as drug abuse and alcohol abuse, promiscuity. The list goes on. So,
mhm.
those are the risk factors that are created when there's exposure to stress in childhood. I will also say that this study did not look at societal factors like
Okay.
poverty, like experience of racism, discrimination, and so on.